sexual aggressors against children, they have a different pattern of attachment, and that's called preoccupied pattern of attachment, wherein they are tending to seek love in anything and everything. And hence, they will tend to sexualize even the most innocent of relationships that they might share, for example, with children. Good morning to the august audience here.
Good morning.
That was loud and clear, sir. Thank you for that. And thank you for having me here. I thought we'll jump into something very, very interesting, but I was blown away by all the talks so far. I hope I can sustain the interest in the audience. So I have a genuine interest in sexual criminality. Of course, there are years and miles to go for me. To do much more work in this field, but I just thought I will share my initial ideas of psychopathology, which is related to psychological criminality, and let's see how it goes. When we speak of sexual crimes, it's very convenient to actually divide it into three formats, wherein we look at sexual violence, we also look at sexual misconduct, and sexual exploitation. So when we say sexual violence, we're basically looking at the aggression involved in it and a whole lot of force. And very conveniently, we can divide that into sexual homicide, rape, child sexual abuse, and so on. In today's topic, the primary focus will be on sexual crimes, which are limited to aggression, because we want to look at the quality or the amount of psychopathology that's involved in such crimes. Of course, there's sexual misconduct and sexual exploitation. Now, these two formats of interaction involve more power dynamics, factors of vulnerability, wherein one is in a position of power and authority, and the other is in a subordinate position. Sexual offending, the most genuine way that we conceptualize it is possibly the males indulging in it. And if we look at the males, then it could be that they are victimizing women, they could be victimizing children, and they could be non-sexual offenders as well. It's very, very handy to understand how these three patterns actually vary. So when we see male offenders offending against women, we see that they genuinely have this hostility towards women, and that translates into sexual aggression. Also, this component of empathy, which I will emphasize on sometime later. Empathy is basically being able to place oneself in another person's shoe and thereby being able to connect with their suffering or pain. What's understood in sexual offenders who are particularly males aggressing towards women are that they do have an empathy deficit. But this is slightly different from what's exactly seen in psychopathy, because psychopathy would have generalized empathy deficits. Here, in such aggressors against women, it's more situational, context-based. Coming to aggression against children by males, they're usually found to have lower intelligence, and they are left-handed individuals, which would more be an incidental finding. And of course, they have a lot of cognitive deficits, which I will come to. And when we look at the non-sexual offenders, they are less self-centered or egoistic, more sensitive, and more remorseful from those who actually aggress in terms of sexual criminality. Okay, we'll also be surprised to know that women too feature in sexual aggression, and the patterns of their presentation is slightly different from that of men. We see that women have a whole lot of social and biological factors which are interconnected, and one very, very important factor in them is most certainly victimization, which has happened very early in their childhood. And they go on to offend when they grow up. And often they are seen to be co-offenders, wherein they have partners in crime. And these co-offenders could be people who coerce them to be a partner in crime, or they could actually be taking their help in itself. Substance use is also quite an important feature amongst women who are sexual offenders, and they actually constitute about 5% prevalence. It's also, it's also worthy to know that offenders amongst women are very, very rarely sexual offenders. They are more commonly involved in interpersonal relationship aggression and violence, and not so much as sexual violence. There's been quite a lot of work done on juveniles as well. Juvenile offenders, both male and female. But the classical feature that I would like to point out would be the impulsivity, which has been highlighted in both males and females who are juveniles and aggress towards others. Now, coming to the psychology of sexual aggression against women. Let's look at it one by one. We will be talking about paraphilias and what we mean by them, cognitive distortions, and something called implicit theories. We'll be looking at intimacy deficits and attachment styles. And of course, an overpowering discussion in my topic would be about psychopathy. So coming to paraphilias. And before I even mention about paraphilias, let me also mention a very, very important condition called Asperger's syndrome. A lot of us may be actually coming across adults who have Asperger's syndrome and would have had odd social interactions which may even err or edge on intimidating someone within their proximity. Often this is called as counterfeit deviance, which means to say they may not actually be having this element of psychopathy. Rather, they would have very poor understanding of what the other person thinks of their advances. So basically, they have something called theory of mind deficits, and it has nothing so much as to do with psychopathy. So I just highlighted this paper because it was one of the papers that I had come out with as a student on a case report of 5 adult individuals with Asperger's who were very wrongly implicated for very overt signs or gestures towards people in and around their proximity. Coming to paraphilias. What should we know about paraphilias? What are paraphilias? So para would mean like love or alongside love, and philia would mean affinity. So paraphilias, if we have to understand genuinely what it means, we'll have to first understand intentionality in sexuality, and when or where does that begin. It's been seen that this is the last of the components of sexuality to develop, wherein children or even adolescents tend to understand what they want out of closeness with another person. So ordinary intentions would be peaceable mutuality. So there is genuine interest among both the people involved to unite. On the other hand, paraphilic intentionality would be more aggressiveness seen one-sided. So we must remember that not all sexual criminals fit into the definition of a paraphilic individual. Like I said, it can involve suffering and humiliation. It can involve children, wherein there could be non-consenting others as well, and more common in men and less in women. Now, this is the list of paraphilias that we already know of, and the ones that are highlighted in red are all of the paraphilias which include criminality, which means to say they are offenses, and the ones with starred are the ones which include sexual aggression, a whole lot of force involved. Coming to cognitive distortions and implicit theories that we must be able to understand, because a whole lot of our management for these individuals may include our understanding of these cognitive distortions. We would be surprised to know when DSM-5 has been formulated over the years, each and every time that there have been meetups regarding it, there has been discussion around rape. And if rape can actually be classified as one such paraphilia. So there was discussion on why not call rape paraphilic coercive disorder. And there has been discussion through it in DSM-3, 4, and so on. But at the end of the day, there was a common consensus that no, rape must not and should not be classified as a paraphilia, because that in itself gives grounds to an individual to plead not guilty, to say that they have an illness and hence there is no way they can be accountable for their actions, which seems quite lopsided. So, so far, this is the stand that psychiatry as a field has on rape. I just wanted to display a few statements that rape convicts have often spoken of during their interviews with psychiatrists involved in the forensic settings. So this is one such narrative. We have a rape convict saying, I love them, I love those girls, they're dirty girls, bad girls have more fun. We constantly are surrounded by girls like that, girls for that, that is sex. We have a real hard time handling rejection. They also say, this one particular individual also said, they are the weaker sex. So, you know, they at least need to control something. So we are actually helping them, you know, become more well-versed with, you know, boundaries. Another individual goes on to say, I'm not saying that she didn't enjoy it. Maybe she had some ulterior motives. She wanted somebody in her life, and this is basically a game of cat and mouse. Now, after listening to these narratives, we know that these individuals who have aggressed have very convinced ideas. Where does this stem from? A very, very important study by Polaschek and Gannon said that this could actually stem from what we know as implicit theories. Now, implicit theories have been largely formulated in terms of rape. And what do they speak of? These are some of the very, very fixed notions these convicts or criminals could have. That women are dangerous. Intimacy deficits and attachment style. It'll be of great interest for psychiatrists to evaluate the attachment styles of adults. But I would urge the audience here to also keenly look for these aspects in the individuals that you come across who have aggressed against other individuals. Now, when we look at intimacy or attachment style patterns in these offenders, there could be basically two types. Again, we are looking at aggressors against women and against children. So the adult form of attachment, known as dismissive pattern of attachment, is an insecure form of attachment, which means to say it is a problematic form of attachment. These individuals will have high avoidance pattern. They would not like people. They would not want to establish any sort of contact with anyone so as to so that the relationship turns intimate at all. They would like to maintain their distance. They would like they treasure their independence. These are the individuals who are inclined to be violent towards women. They also have a lot of negative schemas that we just spoke about. Coming to sexual aggressors against children, they have a different pattern of attachment, and that's called preoccupied pattern of attachment, wherein they are tending to seek love in anything and everything. And hence, they will tend to sexualize even the most innocent of relationships that they might share, for example, with children. I'll just quickly mention a few models of sexual offending. And that's important to understand how psychopathy can actually feature in most of these models that have been highlighted. So we look at something called the integrated theories of sexual offending, ITSO. And here they highlight biological factors, they highlight ecological factors, neuropsychological factors, as well as personal agency or control. And amongst all of these, the third factor, which is the ecological factor, the neuropsychological factor is the factor that we are again emphasizing on. The psychopathy patterns may emerge here. Another model of sexual offending is the three-component model. Here too, we have highlighted two very important aspects. One is the callous, unemotional traits and the antisocial traits, both of which that can lead to sexual coercion. Another model which says that you can have general deviance, which then gradually progresses to sexualization and leading on to sexual deviance and sexual criminal activity. Another model which looks at what are the motivations for an individual to involve in rape. It could be that they are pervasively angry. There could be sadism, again, psychopathy involved in it, opportunistic, vindictive, non-sexual, sexual, non-sadistic, and social competence. The last of the models, now this again highlights sadism, which means to say getting sexual gratification by showing power and violence and aggression during sexual intercourse. Coming to the neurobiology of psychopathy. I have a very interesting example for explaining what we mean by this. So first of all, I would want to ask the audience to focus on an example that I'm going to speak of. So let's think of this particular situation that we see. We have a railway track, and we have a group of workers on the railway track. They're quite oblivious to what's coming their way. They have no idea, but what they are in for a surprise is actually a train which is heading on the same track. Okay? Now, there is also another railway line which is parallel to the main railway line. There, we see one worker working. So we have a set of 5 workers on one main line, and we have another adjacent line with just one worker. And the train is headed onto the main railway track. We also have an overhead bridge, and we have 2 onlookers who already are preempting what's going to happen next. They're fearing the worst. If you, among the audience, were the drivers within the, if you were the linesman who's working at the side of these railway tracks, who can also observe what's going to happen, and who has also noticed that the driver on the railway coach has no idea of what's going to come because he obviously can't see them, it's at a distance, what would you do if you were the linesman? What else would you think of doing? How would you do that, sir? Okay, you would try to stop the train altogether through signals. Right. Now there's a, yes, please.
Actually, this is a question in the philosophy that is
exactly
put. And the thing is that usually in life, there are 3 dilemmas which are having. Number
yes.
1 is whether to select between good or more good, and that is always very easy. Second dilemma is between good and bad. Objectively, I'm saying, from objective
sure.
ethics, not subjective ethics
sure.
point of view. So that is also easy. Now, this question pertains to that final situation where human beings have to select between bad and more bad. And that is what the entire life is. Actually, so this is the question. Now, there could be many parameters that could be running.
Sure.
And from here, even we can extend this to politics. The entire politics also runs around this.
Really appreciate
so that is
your
more
answer,
of the reflection.
Really appreciate your answer.
There could be several answers.
True.
And depending on in the which way we are seeing so many other parameters. And that's the reason why in human life, the intentionality and the meaning, the reference and the intentionality always changes the meaning of the situation. So you put different parameters, you will be getting different answers.
That's so true. So true, sir. So
Thank
I'll
you.
just add to your confusion, and thank you for that, sir. Now, the people who are on the bridge watching what's going to happen, one amongst them, the smaller man, suddenly gets this idea. Why don't I push the person who's adjacent to me right onto the main track? So that's going to be the early warning sign for the driver in the coach to stop the train. And perhaps he's so heavy, he might actually derail the train as well. So it's still a good possibility of saving 6 lives. So he thinks of that, of doing that. What do you think of that idea? Right. No, sir. Fortunately, unfortunately, no. Okay. I'm glad that all of you really racked your brains around this particular question. As was already pointed out, this was one of the very important philosophical questions which looks at moral dilemmas in life. And the reason that why each one of us was silent, introspecting, thinking of various answers is because it triggered something within us. We felt that we have to save lives. So do we save 5 lives? Do we save 1 life? Do we not traumatize the person over the bridge? What do we do, right? Which means to say, it's safe to say, none of us have psychopathy, okay? What we want to...
Excuse me,
Yes.
and one more reflection
Yes.
is that that's a fundamental question, that what is the value of human being?
Exactly.
On which rests the question, the self-worth. And we cannot say that this particular individual is 20 units valuable and that individual is 30 units. So I think this question will always be there till infinity.
Right, sir. Okay. So that's very valid. Just to make us understand that moral dilemmas in our life bombard us every now and then. And we are troubled by them only because it questions our morality or our own ethics. But for a person with psychopathy, this is not of any relevance. How does it matter if 5 die or 1 die or push someone else? Or why should I even bother? How does it hurt me in any way, right? So when we are looking at moral dilemmas, largely we have 3 types of moral dilemmas. We have personal moral dilemmas, impersonal moral dilemmas, and non-moral dilemmas. So personal could be that, should I smother a crying baby to save myself and a whole lot of the townspeople from the terrorists coming in? An immoral dilemma would be, should I just flick this money from this wallet? And a non-moral dilemma would be, should I take this train or that? Should I take that bus or this? For each of this, it requires a whole lot of self-searching, and that's what I was coming to, that individuals with psychopathy may lack this. So let's look at this case wherein we look at judgments. We just spoke about reasoning, we look at judgments. So there is a new entrant into college, and there is a senior who's possibly someone who thinks very highly of himself and wants to teach the youngster a lesson. So he punches him onto his face. So A punches B. What exactly is happening within his brain? For A, the part of his brain, that's the amygdala, is able to associate the person's internal distress with what reaction or response has happened with the other person due to his action. So I hit with anger, B was in pain, my clenched fist punched his face. This is what registers in the amygdala. And there is another part of the brain known as the ventromedial prefrontal cortex, and this categorizes the degree of the crime. So was it moderate transgression? Was it less transgression? Was it highly volatile transgression? Now, why do we need to know that? Because when we are looking at psychopathic individuals or individuals with these traits, as we saw, moral dilemmas are not something that they need to deal with. That's simply because the guiding force that amygdala has in most of us is not prevalent in them. There is a reduced functionality of the amygdala. As a result of which, they can get involved in a whole lot of impulsive activity, a whole lot of immoral activity and irresponsible decisions. So when we are looking at psychopathic traits, the two main features will be callous, unemotional traits and impulsive, antisocial traits. And this can be detected as early as 3 years of age in individuals. And hence, earlier the intervention, more malleable these traits are. And hence, we know how important it is for us as mental health professionals and all of you out here to intervene. What do we mean by callous, unemotional traits? Basically, they have no pro-social emotions. There's lack of remorse or guilt. There is callousness, and so on. Very importantly, two aspects that we need to know. One is cognitive empathy, another known as emotional empathy. So they will know that dragging or pulling the hair of someone causes pain, but they will not have the subjective experience of how pain feels like. Okay, so that's the main importance here that we need to know. So psychopathy again has trouble in terms of affective empathy. Individuals will not be able to recognize any of these emotions in someone else. Happiness, sadness, fear, pain, all of this. I'll now quickly rush through what we know as sexual recidivism. So sexual recidivism would mean an individual who has offended and then goes on to offend again. So what has been understood is psychopathy and antisocial traits in a more larger term could be a strong indicator when it comes to reoffenses. And we must understand, yes, sir. I'll be done, sir. Yeah. We must understand that it declines over time, but if we were to intervene through interventions, it can actually come down to a large extent. So what do we do when we come across these individuals? Psychotherapy, how effective would it be? Now, there are very specific ways of handling these individuals. What we do understand is because of the cognitive distortions, there are ways in which CBT techniques in itself can help. Assertiveness training, wherein they learn to say no, wherein they learn to understand social cues through social skills training. All of this could be very, very integral parts of psychotherapy. Something else that we need to know, and what psychiatrists and mental health professionals have been using for a long period of time, is the RNR model or approach, wherein we look at who's the population at risk, what are their needs, and how should we respond. Good lives model is something that has been very, very prevalent all over the world, not so much in India. What does it talk about? It says that there are 11 primary goods in every human's life, which we all have motivation to attain. And if the threshold is somehow lowered, that's when they tend to offend, or if the number of goods are very less, that's when they tend to offend. So a primary way of helping these individuals will be to help promote the other primary goods that one can have in life. So this could be life, knowledge, excellence in play, work, agency, inner peace, relatedness, community, spirituality, happiness, and creativity. Berlin disexuality therapy is something that Germany has been indulging in, and this has a model which includes CBT as well as emotional regulation skills, which are taught to individuals who offend against children. Or at least the ones who have propensity to indulge with children. I've spoken so much, but lastly, I just wanted to highlight about the Indian law and the criminal law that came into action was in 2013, and this was soon after the Nirbhaya case. After hearing out the entire conversation that we have had so far, I want you all to recollect the times when this case was actually going on. I do remember what I was feeling when I was listening to this on TV. We had activists who were saying that we need to save lives of the people who have offended, and they have a right to live life too. And I remember the enragement that I had from within. I remember how irrational this thought was about saving lives of offenders. Years later, when I entered the field, and right now as I talk to you, I hope I've been able to convey to you that if we are able to intervene at various phases in lives of offenders, there are ways in which we can save a whole lot of people from being victims of these offenders and also giving them a good life. So with that, I would like to close. Thank you for your patient listening.